Hello, everyone. It's Connor here. I'm here with head athletic trainer Erika today. How are you today?
Pretty good. How are you, Connor?
I'm doing good. Thank you for asking. So, what got you into athletic training?
Oh wow. Way back when I was in high school, suffered a couple pretty terrible injuries. Spent my entire senior year in the athletic training room, and that's kind of when I learned what athletic training was. Followed a lady named Lindsay Peltier, and got into the field. In fact, she was the one that wrote my letter of recommendation, getting in. So.
Um, so, after getting that letter of recommendation, where all did you end up going to school, and what degrees did you get?
Yep. So I did my undergraduate degree at Marietta College in Ohio. So I have a Bachelor of Science in Athletic Training. Also got a minor in coaching while I was there, kind of more or less for fun. Then I went on to West Virginia Wesleyan College, did a master's in an advanced athletic training degree. And right now, here coming up real soon, I'm about to finish my MBA here at Bluefield University in Healthcare Administration on December 10th.
What would you say your favorite thing about your job is?
Oh man. Well, of course, anybody that's an athletic trainer enjoys just kind of the process of. Unfortunately, athletes do get hurt, but watching them return to the field is probably the most rewarding part of the job. Watching the whole process from start to finish and kind of cheering them on at the end. So.
On the contrary, what would you say is their least favorite part of your job?
When they get hurt, probably,
hurt.
and they're going through that tough time, or sometimes when they're hitting that wall in rehab is probably the toughest part of the job. Unfortunately, giving bad news, all the things that go with that, telling somebody their season's over, not a good time.
Yeah, I remember you told me mine was over.
Yes, yes. Unfortunately, I had to have that conversation with you as well. So.
If you hadn't been an athletic trainer, what do you think you would have done?
Oh man, when I was in high school, I really didn't know what I wanted to do until I got hurt. Like I said before, coaching may have been possibly on the table.
Get me cold foam. You just know me so well.
Okay.
I'd also thought about being a doctor, but I definitely didn't want to take a lot of chemistry to do that.
Absolutely.
So really, my other choice probably would have been orthopedic PA. So.
I guess my next question for you is, I'm looking to be a physical therapist in the future, and how would you say athletic training and physical therapy kind of intertwine, and like as far as the studies go, and how they would work together in certain scenarios and stuff like that?
Absolutely. They're obviously heavily intertwined in my personal opinion, and I know that a lot of athletic trainers and PTs alike would say the same thing. PTs, they have an advanced degree in actual physical therapy, the rehab aspect of things, as well as, analyzing certain things on a higher level maybe at some points. Athletic trainers, it's a little bit different for us because we see a lot of times the injuries actually happen. We get to do a lot of the rehab as well, but sometimes there are certain things that are just outside of our scope. And sometimes an athletic trainer and a physical therapist will work on the same case together, working with an athlete. You may have somebody seeing an athletic trainer 3 days a week and a PT 2 days a week, that kind of a thing, just to kind of get a better rehab process going. But I would say they're not the same, but they definitely work together.
Cool. To elaborate on that a little bit more, I know you can't use names because of good old HIPAA violations, but can you give us an example of when you and a PT maybe work together on an athlete or patient in general?
Yeah, so we had one here actually a few years back before your time. It was a hip labrum. Unfortunately, this kid had a pretty catastrophic injury. It wasn't just a labrum, I guess I should say. It was both sides of the labrum, also a fracture in there, so it was a pretty complex case. This kid ended up having to go through 3 actual surgeries of repairing things. It wasn't just a one and done. And so we kind of split time between the physical therapy and the athletic training. and got her back running at least. It was never a case where this athlete was going to return to play, though. So that kind of made this case pretty challenging. And we've definitely worked in tandem with the local physical therapy clinic with some back injuries that were a little bit more challenging. In our field, we don't have a lot of experience with backs in regards to things like spinal stenosis or degenerative disc disease, those types of things, because athletic trainers are typically, at least in the athletic setting, working with younger patients, so we don't see those things as often, and so sometimes those are some of the areas maybe where we need a little bit of assistance with some advanced physical therapy ideas and direction. So,
just to backtrack, more from my understanding and learning, you said one of the hardest parts of your job was when an athlete hits that wall during their rehab process. How do you, kind of pull someone out of the gutters and keep them going in that process? Because I know from experience that's tough.
Yeah, it is. First and foremost, being an athletic trainer, you have one advantage with that. This is somebody usually that you, if you're working with a team, you see them every day. You've built a relationship, hopefully, before the injury ever happened. And so you kind of have that advantage. You know the person. You can see, unfortunately, when it's happening, and explaining to the person what's happening helps. So they understand what's kind of going on with themselves. Giving them ways to try to combat it as they're trying to work through it. Also having empathy, for sure, is very important. Regardless of an athletic trainer or a physical therapist, you gotta have it.
So would you say that the ability to be empathetic and motivated and build those personal relationships is just something that kind of led you to get into this field, or is that something you can learn, or you just got to have it?
I think it's a little bit of both. Some people naturally just have those interpersonal communication skills and empathy in general, and they're good at it. And then there's some of us, like me, unfortunately, that have been through some of the injuries that some of our athletes have been through, and so we understand because we've been there. And sometimes I think that makes somebody a better clinician sometimes, just because they have been there. But in general speaking, it's not something you can just flip a switch. It's something that's going to take time if you don't naturally have those abilities to learn. Just some people don't have that good bedside manner, if you will. So,
how long have you been in the field for?
I was certified in December of 2010, so coming up on 12 years here next week or so.
Congratulations.
Been here for almost all of it.
Absolutely. So you've probably been through a lot of different employees and athletic trainers here.
Yeah, we've had a few, but had some consistent ones as well. You know, Josh has been with me now for 8 years, so yeah.
Anyone in particular you miss? Maybe just their brain. Any
Oh yeah.
Any nerds in the field that you kind of miss here, miss their brain?
You know, I definitely miss Esteban Apodaca for sure. He was a good one. He went on from athletic training actually and this is kind of where there's some bridging. He went on and did a bridge program in PTA. So he's kind of an athletic trainer PTA, so that's kind of an interesting thing. He completed that program actually while he was an athletic trainer here. But he's somebody I missed. He was a brain that I could pick. So he was a lot of fun. Had some good GAs in the past as well that always had some new innovative ideas as well. Not naming a bunch of names, but, in a specific class I had a lot of good ones. I was lucky. I had Terry Wood, Libby Medvin. I had Emily Evans. They've all gone on. Still all athletic trainers. And then I've got Kyan Fernandez also out there as well, still an athletic trainer. So definitely miss all that group for sure. So.
One more thing before I let you go. Do you have any advice for me as I go to PT school at Marshall next year?
Absolutely. It's going to be a little bit of a different ball game now. A lot of hands-on stuff going to come your way. Don't be afraid to get in there and practice and look silly. ask questions. It's different from just being in the classroom doing a written test. You're doing written tests all the time, as well as oral practical tests all the time. It's a different kind of scenario studying wise, probably as well for you. You know, you've been blessed, as a lot of students are, that are getting into PT school, just academically gifted, but it's going to be a little bit different now, having to learn how to really buckle down and study and get it on the hands-on stuff for sure. It's a little different.
Thank you for your time, and thank
Absolutely.
you for everything you did for me.